What is the primary source of energy for cardiac muscle contraction? A. Glucose. B. Fatty acids. C. Glycogen. D. Creatine phosphate. Answer B. Fatty acids. Which metabolic pathway is the main source of ATP during prolonged cardiac activity? A. Glycolysis. B. Anaerobic respiration. C. Aerobic respiration. D. Creatine phosphate pathway. Answer C. Aerobic respiration. What role does oxygen play in cardiac muscle contraction? A. It is used directly by the myosin heads during contraction. B. It serves as the final electron acceptor in the electron transport chain. C. It activates calcium channels in the sarcoplasmic reticulum. D. It is stored in myoglobin for immediate use. Answer B. It serves as the final electron acceptor in the electron transport chain. What is the primary function of myoglobin in cardiac muscle cells? A. To store glycogen. B. To transport calcium ions. C. To bind and store oxygen. D. To provide structural support. Answer C. To bind and store oxygen. Which of the following statements is true regarding the relationship between oxygen consumption and cardiac work? A. Oxygen consumption decreases as cardiac work increases. B. Oxygen consumption remains constant regardless of cardiac work. C. Oxygen consumption increases proportionally with cardiac work. D. Oxygen consumption is inversely related to cardiac work. Answer C. Oxygen consumption increases proportionally with cardiac work. What is the effect of ischemia on the cardiac muscle's ability to produce ATP? A. Increased ATP production due to anaerobic metabolism. B. Decreased ATP production due to lack of oxygen. C. No effect on ATP production. D. Temporary increase in ATP production. Answer B. Decreased ATP production due to lack of oxygen. Which enzyme is crucial for the production of ATP in the presence of oxygen in cardiac cells? A. Hexokinase. B. Phosphofructokinase. C. Lactate dehydrogenase. D. ATP synthase. Answer laughing face, ATP synthase. What happens to the lactate levels in the heart during anaerobic conditions such as intense exercise? A. Lactate levels decrease. B. Lactate levels remain unchanged. C. Lactate levels increase. D. Lactate is converted back to glucose immediately. Answer C. Lactate levels increase. How does the heart primarily increase its oxygen supply during increased physical activity? A. By increasing hemoglobin concentration. B. By dilating coronary arteries. C. By increasing myoglobin production. D. By reducing cardiac output. Answer B. By dilating coronary arteries. What is the main consequence of chronic hypoxia on cardiac muscle cells? A. Increased ATP production. B. Enhanced aerobic metabolism. C. Cardiac hypertrophy. D. Decreased glycolysis. Answer C. Cardiac hypertrophy.